We all know that smoking has many health risks. But did you know that smoking is also linked to developing dementia? Stay tuned to find out more. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. Smoking has many negative effects on your health, such as lung cancer, heart diseases, stroke, diabetes, and death. But what many people are not aware of is that smoking can also greatly increase your risk for dementia. About 8% of adults aged 65 years and older currently smoke cigarettes. Smoking tends to be more common in younger age groups. For instance, 16% of adults aged 50 to 64 are current smokers. You might be wondering, what makes smoking so bad for your health? The tobacco in cigarettes contains nicotine, which is a cancer-causing chemical that makes smoking addictive. This makes it hard for smokers to stop quitting once they've started. Cigarettes also contain many other dangerous chemicals that can affect your health. Even if you're not a smoker yourself, being around people who smoke can lead to secondhand smoke exposure, which also carries health risks and can increase your chance of lung cancer and heart disease. That is why it is recommended to avoid smoking and secondhand smoke as much as possible. Smoking is bad for almost every organ in your body, including your brain. Older adults who smoke have a 60% higher risk of developing dementia compared to non-smokers. It is best to quit as young as possible, but if you are a current smoker, don't be discouraged. It is never too late to reap some health benefits by quitting smoking. Older adults can be just as successful as younger adults at quitting smoking. The risk of getting dementia is lower in people who quit smoking compared to their peers who continue to smoke. Those who smoke often want to quit, but it can be challenging to do so successfully. One of the reasons for this challenge is the symptoms of nicotine withdrawal. As we mentioned earlier, nicotine is the chemical that causes addiction to cigarette smoking. When smokers quit, they reduce or completely stop the amount of nicotine they consume, which results in withdrawal. Withdrawal from nicotine is not dangerous, but it can be uncomfortable for those who experience it. Symptoms of nicotine withdrawal may include being more irritable, feeling anxious or depressed, feeling hungry, gaining weight, inability to fall asleep, feeling restless, and difficulty concentrating. People who stop smoking might also feel strong urges to smoke when they are first trying to quit. Withdrawal symptoms are temporary, and the symptoms of withdrawal tend to be stronger and most troublesome the first few days after quitting. Typically, you can experience withdrawal symptoms up to 4 weeks after quitting. We understand that it might be difficult, but believe in yourself and keep focused on all the ways quitting will help you in the long term. If you want to quit smoking cigarettes but don't know where to start, here are some interventions that have helped people quit smoking. First, tell your doctor that you want to quit smoking. Your doctor can provide you with information about quitting and offer resources to help you quit. You can also try what is known as the cold turkey method, which is the most effective method and a highly recommended approach to quitting. It involves picking a day to quit completely and committing to it. Once this day comes, the person stops all cigarette smoking. The cold turkey method has been found to be the most successful way to quit cigarette smoking long term. For those who have struggled with the cold turkey method, it can also be helpful to set reasonable and attainable goals to reduce smoking. For example, one can reduce smoking to once a day, then to a few times a week, once a week, and then stop altogether. However, this method still involves smoking for a longer period of time, even if in reduced amounts, which is problematic. It is still recommended to stop all smoking as soon as possible. Some people who are trying to quit find it helpful to take some form of nicotine replacement therapy, NRT, if recommended by their doctor. Nicotine replacement therapy comes in the form of patches, gum, lozenges, and inhalers that help lower your dosage of nicotine when removing cigarettes completely. Using NRT can help you manage your withdrawal symptoms, and it can make quitting smoking easier. There are also some medications that do not contain nicotine that can be prescribed by your doctor to help you quit. People can make lifestyle changes to help them quit cigarette smoking. If you want to quit smoking, think about the reasons why, such as how it can improve your life, health, and well-being. You can write these down and have them serve as a reminder when you need motivation during challenging periods of withdrawal. Start off by making a plan for when you want to quit. Pick a day and stick to it. Think about the times you feel more tempted to smoke. Do you get a greater urge to smoke more at certain times of the day, or mainly during social gatherings? If you can identify when you might feel a greater urge to smoke, then you can plan ahead to avoid or minimize those urges. During those times, it is important to stay busy and distract yourself so that you don't find yourself smoking again. Getting enough physical activity can be a helpful distraction when you are quitting smoking. You can check out our Active Living workshop for more information about the importance of exercise and strategies to get started. Exercise can help with withdrawal symptoms related to quitting smoking, such as weight gain, restlessness, mood changes, and sleep difficulties. If you need help and support, don't be afraid to reach out to those around you. If you have loved ones or friends who also want to quit smoking, try partnering up with them so you can quit smoking together. This might help to keep you motivated throughout your journey towards quitting smoking. There are also professionals, such as doctors or other healthcare workers, who can help you quit. Canada has a smokers helpline that you can call anytime for support. You can talk to them about your desire to quit smoking or any challenges you might be having with quitting. This information is accessible 24 hours, 7 days a week. You can also speak with a quit coach online at smokershelpline.ca. Together, we can all work to help you along your journey of quitting smoking so that you can live a healthier and happier life.